Good evening. Hello, everyone. Dr. Lisa Palmer, Dr. Mama Bear, coming to you live with QNT training, quantum nutrition training, thyroids and travel. Quantum nutrition training, thyroids and travel. So let me know if you guys can hear me okay. Let me know if this big old mic is working as it should. Hi, Bana. Hi, Tanya. Hi, Pocky. Let me know if you guys can hear me on Facebook in Facebook land. So I wanted to talk to you guys about my last quantum nutrition testing class was just this past weekend. It's the fourth class. And it was so cool. It was awesome. We had doctors of chiropractic. Hi, Tanya. Hi, Emily. We had, let me know if you guys can hear me okay on Facebook and on Telegram, if you guys can see me on those, and Mama Bear Live. Hi, Jody. So our last weekend was our quantum nutrition testing class, level 1, fourth class of the year. Hey, Lizzie, and Lizzie was there. Yay. Hey, Teresa. Okay, I'm glad you guys can hear me. Thank you for letting me know. Hi, Jessica. Hi, Talia. And it was awesome. It was epic. I had doctors of chiropractic, doctors of naturopathy. I had nurses in attendance. I had an awesome attorney in attendance. I had chiropractic students. Hi, Nicole. I had homeschool moms. I had a dump truck driver. Um, I had really cool students, and what I appreciate is that these students, no matter what their profession is, were given special gifts. They were born with special gifts. They're very energetic. They can pick up. So you may be a good practitioner. So just putting this out there, you might be a good practitioner if you find that you could look at someone and you understand the emotion, like you understand that they're sad. You understand that you understand like what they're feeling. Some people call those empaths, right? You're an empath. You can pick up on energy in the earth, right? You respond to full moons and new moons. You can feel certain things. You have certain side skills. Animals like you, babies like you. Random people come up to you and ask you questions. When you were younger, maybe your friends came up to you, or maybe now they came up to you and asked you for advice or help. Right? Those are the qualities that practitioners tend to have. And then sometimes they end up in other professions. They end up as attorneys. They end up as teachers. They end up as whatever. And so some of you guys are in other professions, but you're wired as a holistic practitioner, and you know exactly who I'm talking to and about, right? So Jessica is in healthcare. I want her to be in a little bit more of holistic healthcare. But she said people in stores ask me to help them find things. Yeah, people ask me for help in stores all the time, and I'm like, do I look like I work at this store? Does this shirt look like I work at this whatever store, right? So people ask you for help, and so those are the qualities or the characteristics that we might find in a healer or a practitioner. And then it was so cool. It was so cool to see everybody. So I teach a section of the class, and then we practice this. I teach another section, and then we practice it. And then at the end of the class, we put all the steps together, quantum nutrition testing, and my students actually test someone. So I had students test their dad, and their dad was located in a different location, test their kids, test their dogs, test their horses, test their cousins, test their best friend. And so it was really, really, really cool to see how much content I could teach in level 1, to see it doesn't matter what the training background is, to see people understand the material, start applying the material, and start helping people right away. It's just the coolest thing. So Gina says strangers always talk to her in public. I can totally see that, Gina. Gina has side skills too. Hi, Dr. Chris. So the training was awesome. Was the last level one that we have scheduled for this year. Will I train? Will I schedule more in the months of October, November, December? I'm going to say probably not. Probably not, because I think fall could be a little complicated. Level two, the first level two class will launch the end of October. It is sold out. That class is full. No more spots. But I am keeping registration open. So just know we've changed the site. If you do register for level two now, you'll get the old pricing and you will be pre-registered for the next level two, which will be in 2023. And don't worry, we'll have multiple dates in 2023. But yeah, that class is full. So that's exciting. Gonna talk more about complicated cases, gonna dig more into dental issues, gonna dig into more into what do you do when cases don't respond. I'm gonna teach you new product lines. It's so cool. I'm excited and a little overwhelmed working on the material because it is so much content, but I definitely want to make sure that you guys leave Florida having increased your skill set. And I'll tell you, the last four level ones, really, really, really positive feedback. Very happy with how the class came out. I wanted to talk a little bit about thyroids today. Oh my goodness. Thyroids are just getting really beat up. The thyroid gland is the bow tie shaped gland. Hey, Alina, bow shape, shaped bow tie. Let's try English. Bow tie shaped gland. That should be like a tongue twister in the front of the neck. And what it does is it has an effect on how much energy you have and how much energy you don't have. And so there's a lot of people these days that are exhausted, like they're walking around exhausted and they drink a ungodly amount of caffeine, not only in the form of coffee, but in tea, but also energy drinks. The thyroid also has an effect on whether people feel too hot or cold. And I keep seeing all these like middle school students, so you guys can let me know. Middle school students and high school students in Florida wearing hoodies, hoodies, the sweatshirts with the hood in the summertime. And I'm like, it is a million degrees. I got on the car leaving the office today. It was 95 degrees. Hi, Susie. It was 95 degrees. It was so hot. And I see kids enter the office with these hoodies on. And I'm like, oh my gosh, their thyroids are not working well. The thyroid has an effect on their thermostat, whether they feel too hot or feel too cold. So a lot of women, they have freezing cold hands or they have freezing cold feet and they shove their feet underneath their warm husband, or they touch their husband's back with their freezing cold hand and the husband's like, bah! That could be thyroid. Hormonal issues, so PMS, premenstrual syndrome, that could be coming from thyroid. Menopausal symptoms, you should not have menopausal symptoms, hot flashes, low libido, dryness, all that. That could be coming from thyroid. And so, I'm about to travel, hence the third topic. I'm about to travel. We're going to go to the CellCore ECO seminar. So ECO stands for Exponential Clinical Outcomes. I'm so excited. A lot of my friends are going to be there. It's going to be like a reunion. But in addition to that, I don't want to say but in addition to that, they're going to present new material. So we're going to have case studies. We're going to learn, maybe they'll have some new toys for us, some new product lines. And it's awesome. It's like very cool practitioners getting together, probably a couple hundred of them in the room and networking, sharing, catching up, but also getting great, great data. Susie's asking, what does it mean when your thyroid is protruding? I've been talking a lot today. So if the thyroid's sticking out of somebody's neck, if it's sticking out a lot, it could mean the person has a goiter. What causes goiters? Goiters are due to deficiency in iodine. So when people tell me that they're allergic to iodine, I'm like, you can't be allergic to iodine. You actually have receptors on your thyroid, like little keyholes that need iodine for the iodine to function. If you do not have iodine, your thyroid will not function properly. You have to have iodine. Now, what I really think people mean is when they eat shellfish that has iodine, they have a reaction. Now, are they reacting to the pollutants in the lobster or the pollutants in the shrimp? And that's why they're having a reaction. Or is it the iodine? I would say that it is probably pollutants in the shellfish. The shellfish, lobsters are the cockroaches of the sea. I'll still eat them. They taste good to me. And they're not like a healthy animal. Iodine contrast, you can get hives. Why hives? Well, if you have radiation, so dental hygienists, x-ray techs, flight attendants, um, IT guys, we just worked on an IT guy in this last level 1, tend to carry high levels of radiation. If you take iodine, it can push the radiation out. Just like if you were to take high levels of niacin, niacin will also push radiation out. Water will help with radiation, and radiation and toxic chemicals will get stored in fat tissue. And so, you need to have iodine for proper thyroid function. Now, I was working on a case, and this lady had issues with her thyroid. And so most people that have issues, they go to their general physician. The general physician might run some blood work, maybe not find anything, because it seems like the thyroid takes a little bit of time to show up. In other words, your thyroid has to be really bad for it to show on blood work. And so she ends up at the endocrinologist, and she's been my patient for a couple years. And before some things happened, she was doing super, super, super good. She was doing really, really good. And then certain life events happened and the world shut down and she got stuck in another country and all this stuff. And long story short, she's like, well, my endocrinologist wants me to stop all my supplements and wants to see what my thyroid looks like with just thyroid hormone. And I said, okay, well, if that's what you want to do, I mean, I am there as a holistic practitioner, as a doctor of chiropractic, as a holistic, someone who does holistic nutrition. I am there to guide them, right? And ultimately, and educate them. And ultimately, it is the patient's choice to do whatever they want, right? Whatever they want. So I've had patients in the past, I get them to a certain level, but they really like red wine and they want to keep doing the red wine and I won't be able to get them past that. Okay, fine. I've had patients in the past where I'm helping them with migraines and this and that, and they really love to color their hair red. And red chemicals kept showing up, and I was stuck there. And I said, look, I'm stuck at this point. I'm having difficulty getting you to the next level because your red hair dye, which can have lead in it and other heavy metals and chemicals, I can't work around that right now. Like I'm stuck. Are you willing to do henna? Are you willing to do something else? Are you willing to not dye your hair? And the patient was like, no, red is like my signature color. And I'm going to keep dyeing my hair red till the day I die. And I said, okay, well, I can keep maintaining you, but I'm really stuck with your case. Now that was before I had, supplements like this, like biotoxin binder. Maybe with the biotoxin binder, I would have been able to get her over that kind of a little hump in the road or a little, glitch that we had. But she was like, no, I'm happy where you got me. And I like to dye my hair red and I'm not stopping that. And that was it. And I said, okay, cool. Well, I'm here. And in the future, if you need me, that was it. So with this patient, she had some stuff happen to her and she's like, well, I'm gonna go to the endocrinologist. And the endocrinologist said, okay, your thyroid's not working right. They put her on thyroid hormone. And I hadn't seen her in a while. And then I realized she was on my schedule recently. And I realized that the endocrinologist scared her, told her to stop all her supplements, which she did. And when I saw her, she didn't look that good. Her eyelids were puffy, which is a sign of thyroid. She was exhausted. I'm like, how's your energy? She's like, really not good. I'm like, well, how's your mood? She's like, and her husband's like, well, I've been crying. And so, and then he was like, she's grumpy, she's irritable. And then I asked her something and he was like, see, she's grumpy. And I'm like, okay, you're not helping me. And it was very obvious that the thyroid wasn't working properly. So I'm trying to quantum test her and I can't. Like her arm is not working for me. And I'm going through all the reasons why, is it chemicals? Is it metals? Is it mold? Is it stress? Is it radiation? Is it all this stuff? No, none of that. And then it turned out that it was linked to her thyroid. And so I looked at her old program, which she had quit months earlier, and a supplement called Thyroid Complex. It's not a hormone. It is not a medication. I do not have a license that gives me the prescribing right for medications, and that's good and it's bad. It's good because I don't want to prescribe meds because they all have side effects. It's bad because sometimes people need medications to get over, something really bad like an infected leg. And then they carry on. So she wasn't taking her supplements, and I tested her on the thyroid complex, which is from a company called MediHerb, and I tested her on CT iodine, and those two supplements got her body working again. And she goes, well, what about parasites? And what about this? And what about that? I'm like, look, like your system won't let me do anything else until we get your thyroid back on track. And right now, it appears that the thyroid medication that you're taking, I didn't prescribe it, but the thyroid medication that you're taking is not where it should be. So I would suggest that you call your endocrinologist and you let them know that you are tired and you are grumpy and you don't feel good. And she goes, well, I already told them. That's why I'm going back in September. I'm like, well, call again and tell them again, because they need to change the dose and they can do that over the phone. And she goes, oh, okay. And I go, so what do you want to do with me? Like, I'm telling you that supplements are going to help balance out your system. They don't treat, they don't cure, they don't diagnose, but they're going to help balance out the cause to why your thyroid got upset to begin with. She goes, well, I'm not taking them. And I said, okay, well, that's fine. And she goes, well, my endocrinologist, he doesn't want me on anything until September. I'm like, okay, that's fine, but I'm just letting you know that he's been working with you, and I'm noticing you're getting worse. Your face is puffy, and I tell patients, I'm like, your face is puffy, your energy is not good, you don't seem happy. My suggestion is that you take these supplements. They have no side effects. But I understand that you're saying that your endocrinologist wants you to just take the medication. I understand that. So I guess it comes to, do you want to listen to what he's telling you, or do you want to listen to what I'm telling you? Well, I need blood work ordered. I'm like, I can order blood work. I can order blood work. I can order imaging. I can order CT scans. I can order MRI. I can order whatever test you want. I just can't write you a prescription. And in the past, I'm like, well, maybe I just need a medical doctor on staff so we don't have to go through all this rigmarole, right? We don't have to deal with all this stuff. And so she kind of looked at me like, you can order blood work? I'm like, yeah, I've already told you I can order blood work. And so I go, what do you want to do? And she goes, well, I'm going to wait till my appointment with him in September. Okay, if that's what you want to do, that's fine. So I told Kaylee was in the room with me. I said, Kaylee, put in the chart that she doesn't want to do what our recommendations are. And then I'm telling her that she needs to call her endocrinologist tomorrow, because it was after hours, tomorrow, and let him know that she does not feel good. So thyroids, I was trying to let her know that in almost 20 years, I have never seen a thyroid case come off thyroid medication when they're just doing thyroid medication. I've never seen that. What I see over and over and over and over and over again, to the point where I'm tired of seeing it, is an endocrinologist. Nothing against them. They're just doing what they were taught to do, right? Turn up the thyroid medication, turn down the thyroid medication, turn up the thyroid medication, turn down the thyroid medication, turn up the thyroid medication, turn down the thyroid medication to turn up the thyroid. I mean, it's just up and down, up and down, up, down, up, down, up, down, up, down. And so when the thyroid gets more hypothyroid, they get tired, they get depressed, they gain weight, they don't feel good. When the thyroid medication or the thyroid goes too fast, they get anxious, they get irregular heartbeats, they feel nervous. It's awful. It's like a radio, like turn the volume up, turn the volume down, turn the volume up. I don't want to scream in your ear, but it's awful. It's an awful, awful thing. Now, when we identify the cause of why the thyroid's irritated, maybe it's a chemical like chlorine, maybe it's radiation from all the EMFs, electromagnetic fields from cell phones, desktops, laptops. Maybe it is maybe a parasite. We've seen parasites bother the thyroid. So when we identify the cause and we give the body the proper nutrition to rebalance its imbalances, I've seen people not need thyroid medication. I don't personally take them off, but I'm looking for certain things. Like if they start to get a little anxious or they start to feel hyper, I tell them, look, they're showing signs that the medication may be too high. So what I want you to do is call your doctor and say all the things you just told me. I am feeling anxious. My heart is racing. I don't feel good. I feel shaky. And what the doctor should do, because those are signs of too much, the thyroid going too fast, is what the doctor should do is alter your medications. And so they do. And then in some cases, the patient gets weaned by the help of the endocrinologist, the medical doctor, down to nothing, and then they don't need it anymore because we handled the cause. Hi, Suzette. And that's the way I prefer to handle thyroids. That's how I'd like to do that. And so with our travel, with our upcoming CellCore Eco Trip, so if you are a practitioner and you're on, say hi, let me know you're coming. So Helena, I think you're coming. Sarah, I don't know if you're on. I know you're coming. I am hoping we learn some more endocrinology tools. They did release estro. Estro does help with female and male hormones. There was a question. You guys can ask me questions now if you want. There was a question on gray hair. Why does gray hair happen? The pandemic is why I have gray hair. So there's different schools of thought. One school of thought is mineral deficiencies. So Dr. Chris is doing virtual. Awesome. Cindy's being there virtual. Yay, Cindy. And so yeah, the pandemic made me gray hairs. That was very stressful. What's happening is very stressful. Most stressful 2 years of my whole entire life, right? My dad being in the hospital, that was stressful. My dad going to the hospital again, that was stressful. He's doing much better now. So thank you for asking. And so gray hairs could be due to mineral deficiencies. So, unfortunately, our soil is very depleted. And so, products like CT minerals, products like Mintran, Minchex, trace minerals B12, organic about minerals is very, very important. The same stuff that's found in healthy soil is what our bodies are composed of. If you are low in minerals, it may reflect in gray hair. It may reflect in losing bone density in your jaw. It may reflect in cavities in the teeth. It may reflect in weak nails. My nails are so strong that I'll let them grow, and then they get to the point like they turn into claws, and I just have to chop them off. So I just recently chopped them off. You need minerals. You need proper mineralization for muscle contraction. If you're getting cramps in your muscles, you might be low in minerals. If you have period cramps, you might be low in minerals. If you're constipated, you might be low in minerals. Like I do a whole seminar on it. I just realized I'm minerals, right? So that is why. So let's see. So who's coming? Oh, Helena's leaving early tomorrow morning. Helena, I am super leaving early tomorrow. That's why I'm going to have to jump off with you guys soon. And Helena, you probably going to have to go to bed too. We have to leave our house at 4 a.m. And so when my students travel for level 1 and level 2, I super, super appreciate you guys handling flight delays, handling TSA, handling packing. I have to go finish packing. Ugh. Does anybody like packing? I don't like packing and I don't like unpacking. And handling all that stuff to come visit me. So I had some students come from California and Colorado, from New England, and they put some mileage in to come visit. I had one student drove like 18 hours to come to class. So I really, really appreciate it. So when I have to return the favor and head out for a 4-hour flight, there's no directs for us. We have to go from here to Atlanta and Atlanta over. So yeah, I appreciate you. So Robin doesn't like to pack either, although I could hang with Robin at a seminar because she has so many essential oils. I'll be like, hey, Robin, hook me up with that one. Alyssa does not like packing and unpacking. Yeah, I wish suitcases unpack themselves, but you know what? We're pretty spoiled with washing machines and dryers. Really, it's not that horrible, but yeah, not my favorite. Lizzie does not like to pack either. Totally got that. So my goal is to reconnect with some old colleagues and friends and bring you guys back some awesome cutting edge CellCore data. I'll be posting while we're there. Check out for some pictures. Helena is all packed. Delta changed your flight, so you have 4-hour layover in Minneapolis. Minneapolis. Oh gosh, I was looking at a flight that was leaving at a better time than me having to wake up at 4 a.m. And yeah, Susie, you are the queen of packing, I'm sure. And it was going to go through St. Paul, and I'm like, I'm not going through St. Paul. So I figured Atlanta, we have lots of choices in flights, and my prayer and hope, and if you guys want to send all of us a safe travel vibes and prayers, that we get there quickly and no big deal and everything's smooth. And when we land, it's supposed to be like 100 degrees. That's crazy. So there you go. If you're interested in taking future quantum nutrition testing seminars, let me know. I'll pop the dates as soon as we have the 2023 dates. We'll pop that up. If you know anyone who needs help with thyroid issues, call the office. We're happy to help you with that. And yeah, so we're traveling to the Cell Core seminar and looking forward to learning awesome new data to help our patients near and far. Thank you, Alyssa, for the prayers and good vibes. The next level one, Marissa, is not scheduled. I have not scheduled any more for 2022. The next class I'm teaching is the end of October, level 2. But you all are welcome to jump into the academy and start learning in the academy. A cell core. So Hyla's supposed to ask cell core to make a gallon size of pair 3. Well, so Hyla's not traveling now, so I'm gonna have to ask for you if they'll make gallon size pair 3. That's a lot of pair 3. Okay, awesome. Well, as soon as the new products are launched, if there are any at this seminar, I will definitely let you guys know. If there's cool things I'm learning, I'll post pictures whenever I can. Hope you guys have a great night. Hi, Jonathan. Hi, Gina. Hi, Lizzie. Awesome. Very, very cool. Everybody have a good night. I'm Dr. Lisa Palmer, Dr. Mama Bear. Good night.